Have you ever wondered what your body might be telling you when you're feeling a bit off? Could it be warning you about a fatty liver disease? A fatty liver disease is a condition where excess fat builds up in your liver. It's a silent epidemic that affects up to 1 in 4 adults worldwide. But what's alarming is that it often goes undetected because it doesn't always cause noticeable symptoms. Imagine your liver, quietly doing its job of filtering out toxins from your body, but it's getting bogged down by fat. Over time, this can lead to serious health complications like liver cirrhosis or cancer. That's why it's crucial to recognize the early warning signs. The good news is, our bodies are communicative. They send us signals when something's not right. And in the case of a fatty liver disease, there are 8 key signs to watch out for. Let's dive into the 8 warning signs of a fatty liver disease. Pay close attention. Your body might be sending you a message. First on our list is right shoulder pain. This might sound strange, but did you know that experiencing discomfort or pain in your right shoulder can be an early warning sign of a fatty liver disease? You're probably wondering, how does that work? Well, let's delve a little deeper. Fatty liver disease is a condition where excess fat builds up in your liver, impeding its function. This can cause inflammation and swelling in the liver, which can lead to referred pain. Referred pain is when the pain is felt in a different location than where the problem actually exists. In this case, the pain is felt in the right shoulder. This happens because your liver is located on the right side of your body, just below your diaphragm. The liver and the right shoulder share the same nerve pathways. So, when your liver is under stress, it can send signals along these nerve pathways, resulting in pain or discomfort in your right shoulder. This kind of pain is different from muscular or skeletal pain. It's often described as a dull ache that doesn't go away with rest or movement. It might be more noticeable at night or when you're lying down. Understanding this connection between right shoulder pain and fatty liver disease is crucial because it can prompt you to seek medical advice earlier. Remember, the earlier the diagnosis, the better the prognosis. So, if you're experiencing unexplained right shoulder pain, it might be more than just a bad sleeping position. Next up is abdominal fat. Now, when we talk about abdominal fat, we're not just talking about the kind of fat you can pinch with your fingers, we're referring to the fat that's deep within, around your organs. This is the kind of fat that could indicate fatty liver disease. The liver is a key player in the body's metabolism, and when it's not functioning at its best, it can lead to an abnormal distribution of fat. In this case, your body may store excess fat in your abdomen. It's a bit like a storage unit that's overstuffed with items. It's not a healthy situation. It's important to note that not all fat is bad. Our bodies need a certain amount of fat for functions like insulation and energy storage. However, too much fat, particularly in the abdomen, can be a sign that your liver is struggling. Now you might be wondering, how does the liver get to this state? Well, the liver is responsible for breaking down and processing fats. When there's too much fat in the diet, or the liver is damaged, it can struggle to do its job. This can lead to fat accumulating in the liver cells, causing what we call fatty liver disease. So, if you've noticed an increase in your abdominal girth, it might not be just about eating less or exercising more. It could be a sign that your liver needs some attention. Remember, it's not just about aesthetics, it's about your health. Third on the list is visceral fat. Now, when we talk about body fat, it's essential to understand that not all fat is created equal. There are 2 main types of fat in our bodies: visceral fat and subcutaneous fat. Subcutaneous fat is the layer that you can pinch, located just beneath the skin. It's what we often think of when we imagine body fat. But let's focus on the less common term, visceral fat. This is the fat that surrounds our organs. It's located deep within the abdominal cavity, tucked away beneath the muscle, making it less visible but far more dangerous. So, why should an increase in visceral fat be a concern, you might ask? Well, visceral fat is biologically active. It secretes inflammatory substances and is directly linked to higher total cholesterol, bad LDL cholesterol, lower good HDL cholesterol, and insulin resistance. It's like an unwanted guest that causes havoc in your body, contributing to numerous health problems from diabetes to cardiovascular disease. But what does it have to do with fatty liver disease? The liver is an organ in close proximity to the visceral fat. As visceral fat increases, it can infiltrate the liver, leading to inflammation and eventually fatty liver disease. So when you think about visceral fat, don't just think about a beer belly or an aesthetic concern. It's much more than that. It's a hidden threat, a silent assailant that could be quietly damaging your liver. Visceral fat is more than just a beer belly. It could be a sign of a deeper issue. Our fourth warning sign is pitting edema. Now you may be wondering what exactly pitting edema is. Simply put, it's a condition where excessive fluid builds up in your body tissues, causing swelling. When you press on the swollen area, a dent or pit remains after you remove the pressure. This is where the term pitting comes from. This condition is commonly seen in the lower limbs, particularly the ankles and feet. However, it can occur anywhere in the body. Now, how does this connect to liver health? Well, the liver plays a vital role in maintaining fluid balance in our bodies. When the liver isn't functioning properly, as in the case of fatty liver disease, it can lead to fluid buildup and subsequently, pitting edema. Pitting edema is a potential warning sign of fatty liver disease because it indicates that your liver may not be effectively managing fluid levels in your body. It's important to note that pitting edema can also be a symptom of other health conditions, such as heart or kidney disease. Hence, it's crucial to seek medical attention if you notice this symptom. Remember, early detection and intervention can make a significant difference in managing fatty liver disease. So, don't brush off that swelling as just a minor inconvenience. Swelling in your lower limbs should never be ignored, especially if it leaves a dent when pressed. Halfway through our list we have low thyroid function. The thyroid, a small but mighty gland in your neck, plays a crucial role in your metabolism. It produces hormones that help regulate many of your body's functions, including how you use energy, how you produce heat, and how well your other organs work. Now you might wonder, what's the connection between your thyroid and your liver? Well, it's quite significant. Your liver is responsible for converting thyroid hormones into a form that your body's cells can use. So, if your liver isn't in top shape, it could affect your thyroid function and vice versa. Here's where it gets interesting. Low thyroid function, or hypothyroidism, could be a sign of fatty liver disease. You see, hypothyroidism slows down your metabolism, which can lead to weight gain and increased fat accumulation in the liver. Over time, this can develop into a fatty liver. Symptoms of hypothyroidism include fatigue, dry skin, and feeling cold more often than usual. If you're experiencing these symptoms, it's worth talking to your doctor, who may recommend a blood test to check your thyroid function. So, remember, your thyroid and liver are like two peas in a pod. They work hand in hand to keep your body functioning smoothly. Thyroid function is key to your overall health, and issues with it could indicate a problem with your liver. Sixth on our list is constant fatigue. Have you ever wondered why, despite getting a full night's sleep, you still wake up feeling like you've run a marathon? This unrelenting tiredness could be a sign of a more serious issue: fatty liver disease. Your liver plays a crucial role in energy production. It processes the food we eat, breaking down fats and carbohydrates into energy. When the liver is healthy, it efficiently converts these nutrients into glucose, the body's main source of energy. However, when the liver is burdened with excess fat, this process slows down, leading to a decreased production of glucose. This is when you may start to experience that constant feeling of exhaustion. In addition to this, your liver is also responsible for removing toxins from your bloodstream. If your liver is compromised due to fatty liver disease, it struggles with this detoxification process. This means toxins can build up in your bloodstream, which can leave you feeling drained and lethargic. It's essential to understand that this isn't about feeling a little tired after a long day or needing an extra coffee in the morning. This is about a persistent exhaustion that doesn't go away with rest. This is the type of fatigue that affects your ability to function daily, that leaves you feeling worn out and weary all the time. Constant fatigue is more than just lack of sleep. It could be your liver telling you something. So don't ignore it. Seek professional advice if you're experiencing constant fatigue. It could be a sign that your liver needs some attention. Our seventh warning sign is the need for lifestyle modifications. When our bodies start sending signals that something isn't right, one of the first things we often need to consider is changing the way we live. Such sudden needs for lifestyle modifications could be a sign of fatty liver disease, but why is that? You see, our liver is a resilient organ, but it has its limits. An unhealthy diet, lack of exercise, excessive alcohol consumption, or high levels of stress can all contribute to fatty liver disease. So, if you find yourself needing to make abrupt changes to your diet, activity levels, or alcohol intake, your body might be trying to alert you to a problem with your liver. The good news? Lifestyle changes can help manage or even reverse this condition. A well-balanced diet filled with whole, nutrient-dense foods can help reduce fat in the liver. Regular, moderate exercise can increase insulin sensitivity, and help maintain a healthy weight, both of which are beneficial for liver health. Reducing alcohol consumption and managing stress are also key components of a liver-friendly lifestyle. These changes don't happen overnight, and they require commitment, but the benefits are well worth it. Not only can they improve liver health, but they can also boost overall well-being and vitality, leading to a healthier, happier life. Remember, it's never too late to make healthy changes. Last but not least, unexplained weight loss. Now you might be thinking, isn't weight loss a good thing? Generally yes, but when it's sudden and unexplained, it might be a sign of something more serious, like fatty liver disease. When your liver isn't functioning properly, it struggles to metabolize fats as effectively as it should. This can lead to a rapid reduction in body weight that seems unconnected to changes in diet or exercise. Your liver is a vital organ that plays a critical role in digestion and detoxification. When it's not working as it should, your body goes into a sort of survival mode, burning fat and muscle tissue for energy, which can cause unexplained weight loss. It's important to remember that weight loss associated with fatty liver disease isn't healthy weight loss. It's a sign that your body is struggling and needs help. It's not a result of a healthy diet or regular exercise, but a symptom of your body not being able to function properly. Remember, everyone's body responds differently to health issues. Some people might lose weight, while others might gain. It's essential to look at the bigger picture and consider other symptoms you might be experiencing. While losing weight might seem like a good thing, unexplained weight loss could be a sign of a deeper issue. So if you're shedding pounds without trying, it might be time to talk to your doctor about what could be going on. So, those were the 8 warning signs of a fatty liver disease. The journey has been enlightening, hasn't it? We've traversed through the labyrinth of symptoms, from the discomfort of right shoulder pain, the deceptive presence of abdominal fat, to the silent killer that is visceral fat. Each sign, a breadcrumb leading us to a potential diagnosis of fatty liver disease. We've also delved into the realm of pitting edema, a symptom often overlooked, yet could be a telltale sign of an overburdened liver. We've shone a spotlight on the often neglected low thyroid function, which could be a silent accomplice in this disease's progression. And we've acknowledged the debilitating grip of constant fatigue, a sign so common yet so easily dismissed. In our journey, the importance of lifestyle modifications has been underscored. The power to change the course of this disease lies within our daily habits, the food we eat, the physical activities we engage in, and our overall approach to wellness can be the difference between managing this condition or letting it wreak havoc in our bodies. And let's not forget the curious case of unexplained weight loss. While it may seem like a blessing to some, it could be a distress signal from your body, crying out for attention. Now, having recognized these signs, it's essential to remember that this knowledge is power, but only when put to use. If any of these signs resonate with your current condition, it's time to take action. Seek medical advice. Health professionals are equipped with the tools and knowledge to diagnose and manage this condition effectively. Remember, the journey to health isn't a solitary one. Reach out, ask questions, seek help. You're not alone in this fight. The medical community stands ready to guide and support you every step of the way. Let's not allow these warning signs to fall on deaf ears. Let's take them as a call to action, a prompt to prioritize our health and well-being. Remember, your health is in your hands. Listen to your body and don't hesitate to seek help when needed.